As medical practitioners, we live by the motto, first do no harm. Yet each year we give our patients NSAIDs for simple aches and pains. These result in the deaths of 16,500 Americans and the hospitalization of 107,000 others, as reported by the prestigious Journal of the American Medical Association and New England Journal of Medicine.
The side effects of NSAIDs are it can affect your stomach, cause GI bleeding, can affect your renal function, and they cause fluid retention, so there's cardiovascular side effects to the NSAIDs from those conditions.
There is a safer alternative called transdermal therapy. While NSAIDs target only a single point in the arachidonic acid pain pathway, transdermal therapies allow healthcare practitioners to deliver high levels of medication targeting the most important parts of the pain pathway to shut down pain and inflammation without the concern of systemic side effects that come with high serum levels.
Well, NSAIDs, because they block the cyclooxygenase, they block not only the pro-inflammatory mediators like the PGE2, but they also block the protective prostaglandins. For example, they block the prostaglandins you need to generate the lining of the stomach, the mucosal membrane, and what that does is you get GI bleeds from it.
Transdermal therapy also targets multiple receptors on the neuron to increase its threshold for firing, easing the pain. Up to 7 medications are embedded in microscopic micelles, which are dissolved into a transdermal cream designed to transport them. Powerful agents help them diffuse through the stratus corneum, the tough protective outer layer of human skin. Wetting agents then drive medication to high levels in inflamed and painful tissues. These reach difficult-to-access tissues, such as tendons and fascia, at much higher concentrations than are possible with oral medications. On the COX side, diclofenac decreases COX-1 and COX-2 production, which reduces the production of PGE2, the most powerful modulator in the body. On the LOX side, Translast inhibits the production of IL-1 and TGF-beta, while pentoxifylline is a potent inhibitor of TNF-alpha production, a highly inflammatory immune modulator which accelerates all inflammation. The total effect is to sharply decrease the number of modulators produced from both the LOX and COX side and released from white blood cells so that far fewer bathe the nociceptor and the threshold for firing increases as a result. We also saw that inflammation causes the rapid increase of NMDA receptors along the nociceptor, which also lowered the threshold for firing, making the nerve more responsive. The following medications target the NMDA receptor, which slows the calcium influx and prevents depolarization. These peripheral NMDA receptors have been proven to exist both anatomically and with radionuclide traces. These include ketamine, verapamil, gabapentin, orphenadrine, nifedipine, and magnesium. The use of multiple NMDA receptor blockers has been shown in the laboratory to have a synergistic effect. Many sodium channels become activated along the axon during chronic pain, causing the nerve to fire spontaneously. These medications all block the sodium channel to decrease spontaneous ectopic discharges. Imipramine, cyclobenzaprine, tetracaine, carbamazine, orphenadrine. Taken together, these increase the threshold for firing, so a much greater stimulus is necessary before the pain receptors discharge. At transdermal therapy, meticulous efforts are made to ensure that every single prescription delivers 100% of the medications embedded in its high-tech creams. Transdermal Therapeutics is a compounding laboratory organization that has nearly 2 decades of clinical experience in research and development with a specialized focus on transdermal, neuropathic, and inflammatory pain management. At Transdermal's Research and Development Center in Birmingham, Alabama, highly specialized equipment is used to ensure that all of the prescribed medication is fully solubilized and embedded in high-tech creams, guaranteed to deliver to painful tissues. Customer service representatives play a key role in customer satisfaction and the prompt delivery of compound formulations. As a healthcare practitioner, you can customize your own therapy, picking the agents that you like best. You may also rely on clinical experience and choose formulations for which there is an established track record of successful pain reduction. There's a solid mechanism of action for each of these medications in these high-tech creams.